In this video, I am going to discuss the most asked question and answer regarding low-lying placenta. Let's jump into the video. Why do I have low-lying placenta? Your placenta stretches throughout your pregnancy. When your placenta starts growing, it is usually in the lower part of your uterus. But once your fetus starts growing, your placenta should move to the top of your uterus. If your placenta is not moving with the fetus and it remains low throughout your pregnancy, especially in the third trimester of your pregnancy, then the situation is called low-lying placenta or placenta previa. What is the main reason of having low-lying placenta? If you are over 35, or if you have any kind of chemical pregnancy, or if you have gone through IVF procedure, then you have chances of developing low-lying placenta or placenta previa. How do I know that I have low-lying placenta? The most common symptom is vaginal bleeding. During your second trimester and especially in third trimester, if you have vaginal bleeding throughout your pregnancy with on and off mild cramping and contractions, then you would get to know that you can have placenta previa situation. How it is diagnosed? Placenta previa usually diagnosed around 20th week of your pregnancy when you have anomaly scan or you have normal routine ultrasound. At that time, you will get to know that how much your cervix is covered by your placenta. Here I want to add one important point, but before that, if you have not subscribed my channel, then please take a moment to subscribe my channel. Your placenta will move throughout your pregnancy. If you develop placenta previa in second trimester, it may possible that your placenta will move during third trimester. But if this situation occurs in third trimester, and at that time you have very less chances that your placenta will move to the top of the uterus, unfortunately you cannot control at all. What happens if I have low-lying placenta? It really depends that how much your cervix is covered by the placenta. If your cervix is covered fully, then you have no chances of normal delivery and you have to go for C-section only. And it may possible that if you have severe bleeding, you have to go for emergency C-section as well. What could be the risk factor for baby and mother? Let's talk about mother side. You have chances of premature birth, and if you have severe bleeding throughout your pregnancy, then you could be anemic as well. If your placenta remains low throughout your pregnancy, that you have chances of developing placenta abruption as well. In simple language, your placenta can start detaching from your uterus, and it is very dangerous situation because your placenta is responsible to provide oxygen and nutrition to your baby. Once that supply is cut off, at the time it is really life threatening for your baby. Now let's talk about baby side. Your baby can born too early. Low birth weight could be another challenge for your baby with weak immune system. How placenta previa situation can be treated? It really depends upon the severity of your bleeding and the gestational age of your baby. Your healthcare provider will suggest you bed rest, and you have to stay away from strenuous physical activities. You will be given steroid shots so that your baby can develop lung faster. At the time of premature birth, your baby lungs will be developed so that he or she can survive. What are the chances of having normal delivery? Unfortunately, you do not have chances of normal delivery. If your cervix is partially covered by the placenta, you can have normal delivery. But when you have contractions for normal delivery, since your baby doesn't get proper space to come throughout your vagina, he or she can have injury at that time. After that, all negative points, I want to add one positive point, that low-lying placenta or placenta previa is not the reason of abortion and miscarriage, so you shouldn't be worried. Though you have to go through a lot of trauma and depression, but at the end your baby will be survived and you will be fine as well. If you think this information has added value in your life and you have gained some knowledge after watching this video, please take a moment to subscribe my channel. I will see you in my next video. Till then, bye bye.